Yes, we can hear.
Very good morning to you all. I hope I'm audible now.
Ma'am, you are audible. Yes, ma'am, you are audible.
Slide I should see, no? Aita? Are you able to hear
Yes,
me
ma'am.
now?
Yes, yes. Yes, ma'am. Yes, ma'am.
A very good morning to all the respected participants. At the outset, I am extremely
Yes,
sorry for
ma'am.
this delay due to some technical problems. Please bear with me. At the outset, I would like to thank the organizers for having given me an opportunity to share my experience with you all. So, the topic of today is infodemic versus nursing informatics, boon or bane to nursing practice. So, let us understand the term infodemic. It is information epidemic. We are living in the age of information epidemic, and the term was used for the first time in the year 2003 by David J. Rothkopf. So, in the context of SARS epidemics, which we are aware of, this particular term was coined because information spread and out of context and it exploded. That's why the term information epidemic was used during this time of SARS epidemic. And now the topic that the organizers have chosen is so relevant for today's context of COVID 19, where it has grown out of proportion compared to SARS. It has become a pandemic. and pandemic of COVID is spreading, and infodemic, information epidemic, is also happening. So this term of infodemic, sometimes we wonder if it is a negatively coined term, because it is the spread of information out of context, out of bounds, where we are not able to decide whether it is a correct information, or it is a information that is false, or is it false news that is spreading in this time, which is causing lot of difficulty to each one of us, although we are healthcare professionals. So what is infodemic? According to the person who coined this term, it's a few facts, very little fact, mixed with fear, speculation, and rumor, amplified and relayed swiftly worldwide by modern information technologies, having affected national and international economies, politics, and even security in a way that utterly disproportionate with the root realities. See, all of this we are experiencing today in the limelight of COVID 19. And SARS, we have not experienced it to this level, to this extent. And the definition is so apt for even today amidst the COVID epidemic, that we feel that our response to this particular situation is so much meaningful with this definition. So, what is information and what is misinformation? Information is something that is used in a positive light, where we need information, we need data to make decisions, to make activities, to plan activities, etc. But what is the misinformation that we have in the age of misinformation or false news? The role of social media is unlimited. We are aware social media, how information can spread, how it can defame people, how it can uh, turn governments, how people lose power, and how people are stigmatized. Forget about COVID epidemic, even other situations, this has become a practice today in the world. And elections are also happening in this way. And unreliable information is spread far and wide. And nobody has control over the information once you click the button or once you share. It spreads far and wide. Overabundance of information. So, in the context of COVID, initially when the COVID started in China and then spread to Italy and other places, we used to get so many videos, so much information. Each one is speaking so authentically or like authentically with complete information and convincing manner. So you have so much information. Somebody tells you, okay, you drink hot water. Somebody tells you, you steam every day. Someone says, take vitamin C. Somebody else says, you do this particular exercise. Someone else says, okay, if the temperature is higher, then the COVID 19 doesn't spread. So these were all baseless information without evidence, but all of us believed in some way or the other, and we started practicing our healthcare practices in that direction. How do we curtail this sort of information? It's spreading in an unprecedented speed and it's becoming viral. And all of us are aware how this spread of information happened of this viral disease of COVID 19. Similarly, there are so many other news also becoming viral. It's not that there is substance in that particular news or information, but people keep sharing and show interest, so it becomes viral. And it's also fueling panic and racism and hope. People simply say, okay, everybody who gets COVID 19 is going to die. And people say, oh, there are people who also say it is okay if you get COVID 19 or any other disease. It's a mild disease and everybody is going to survive out of this. So there is panic and hope given through this misinformation. So the trustworthiness of this information is questionable, and that is why healthcare providers and nurses and everybody concerned have to be worrying, because it's not accurate. This is spread is so fast. Virus has taken the first true social media infodemic. And reliable guidance is lacking because nobody knows what is authentic information. You ask a treating doctor, the doctor also will say, okay, we do not know. It's not a verified information. So, social media is whipping up global panic and it's the biggest infodemic that we have seen in our history. And this is resulting in a lot of public health crisis. That is a role where we have to play to handle this particular situation. I hope I am audible and clear.
Yes, ma'am.
So
Yes, ma'am.
let us
You're very clear.
examine what are the
Yes.
consequences of this way information is spreading in a very uncontrolled manner. It's a poor information which is making the bad situation worse, and we are fed on onslaught of statements, figures, and speculations. Now, look at the way medicines were given. There were a lot of medicines that were tried and tested, but there was no evidence to suggest that such and such a medicine is effective. Governments even started threatening the other government, okay, you give us the tablets, otherwise we will take care of you. So you can understand at what levels this misinformation or lack of evidence has played a role in amidst this epidemic. Excessive amount of information about a problem that is typically unreliable spreads rapidly, makes a solution more difficult to achieve. So, as facts, rumors, and fear mix disperse, it becomes difficult to learn essential information. You search Google, you get a lot of information. You open WhatsApp University, you get a lot of information. And all of us are in one way or the other influenced by this misinformation. So even World Health Organization felt that it's going to be this way, the infodemic along with the epidemic or pandemic is going to emerge. And the Director General of World Health Organization said, we are not just fighting an epidemic, we are fighting infodemic. See, they slowed down. They did not immediately declare COVID 19 as a pandemic. They said it's an epidemic. But even before we even came to know much about COVID 19, the Director General was ready to say that we are fighting an infodemic. So that shows the significance of this problem that spreads faster and more easily than that of the virus. So World Health Organization goes on to say that they can spread misinformation, disinformation, and rumors during health emergency. It can hamper effective public health response and create confusion and distrust among the people. Now look at the distrust that our people have, and what is the confusion that we have. We had countries where beds were not adequate, and ventilators were not adequate. We also have countries where now in our country and communities we see somebody has fever, they don't want to go to the healthcare facility because of the fear, because of the say because of the stigmatization that is associated, or because of the indifferent treatment meted out to them. So that is a creation of confusion and distress that we have among people, which was very much early identified by World Health Organization and the different departments there. So, what is a public health crisis? We have all heard about these statements. Outdoor temperatures over 25 degrees Celsius prevents COVID 19. It was a statement that was made. We do not know who made this statement, but there were popular people who announced this, and it became a blunder. If you can hold your breath for 10 seconds without coughing, you don't have it. I have seen this message being circulated. So I even try to see if I can hold my breath. Many of you would have done that. But it doesn't mean that you are not going to get COVID because your respiratory system is so strong. 5G mobile networks can transmit the virus. So funny. Adding hot peppers to your food can protect you. We all tried this. The home remedies, pepper, we tried ginger, we have tried turmeric, we have tried so many things. But a lot of us have also got the problem even after we consumed it. Many had acidity related problems. They had holes in their stomach. So, who is going to take care of this, or who is going to be responsible for this misinformation? Houseflies and mosquitoes can spread the infection. So, this it is not necessarily that these examples are for COVID. For example, HIV infection. People used to say housefly is going to spread, mosquito is going to spread, but it's not that way. It is otherwise. And it sounds, all these statements and many more, what all of us have come across, sound so ridiculous. And we are battling with the impaired ability. Why do we say we are battling with impaired ability? We are able to make a diagnosis of the person's characteristics, conditions, and thought processes. And after having gone through this particular phase, we can say that a lot of us had impaired ability to tell the fact from the fiction, as we are fed on onslaught of statements. Four people make statement, 10 people make statement, or it comes as a newspaper article. Then it means, although we are not having impaired ability, still it is cementing the information or misinformation that we have, which makes us believe that everything is fine or this is the way to handle a situation. So, in this situation, how do we take care of ourselves? It's only possible if we have people who bring out scientific evidence, will make it public, and not to rely on the social media, and unauthorized information should not be shared. Unauthorized information should not be communicated in any way, because there are a lot of people who are being misled with this sort of information that we spread. So let us hope that, at least as healthcare providers and responsible citizens and educated public, we become aware of the crisis that infodemic is going to cause. And therefore, be careful whenever you click share, be extremely careful, because it may be a misinformation. Let it be a verified information that you share, and not the misinformation. So, hope all of us will learn a lesson from this and take cue, so that we have proper actions while sharing or communicating information. Whereas, on the other hand, informatics is dealing with proper information that is used, that is spread or used with the information technology or the computer. So computer systems are used to transform input data into output information. So you give some data which may not be so meaningful, but you get output information. You get to organize that information, it gives meaning, and that is the output that we expect at the end of informatics. So, nursing and informatics. In the older generation of nursing, they were not very computer literate. And see, even in the 1990s, we didn't have a computer. It was always the typewriter we used for making our chapters or typing out our assignments. Whereas late 1990s and 2000 year, there was so much information technology developed, and common man started using information technology. So forget about the old nurses. They were not computer savvy, and they had to do everything in the physical mode, and they had to they had no information about the digital information. But now we are living in the, say, in the abroad countries. From 1980s it all started, and they started using technical and digital digital environment was there. And we know that nurses are the largest workforce, and they provide service in various settings, and nurses are otherwise called the patient care coordinators. And when we say patient care coordinators and largest healthcare workforce, which makes a difference in the health status of the people, all what we do should be evidence based. And in fact, informatics or use of computer technology will ease our process of being evidence based. I'm not saying that those who are not computer savvy are not evidence based or they don't use evidences, but informatics help us in being more evidence based. So there are some definitions and all that. I'm not going to the details, but information nursing informatics has a great role to play in the future healthcare delivery system. So when we talk about the nurses who work in the nursing informatics, as you know, it is a young domain or young branch of nursing, where tech savvy people, people who have the resources, who are able to handle the computer technology, are more and more putting up their work in using computers in their clinical or work situations. So mainly the nurse informatics. In the nursing informatics, the person who is involved, they are a liaison between stakeholders. So who are the stakeholders of nursing informatics? So you have a computer manufacturing country. There are people who work on the hardware. There are people who work on the software. And this computer is prepared based on inputs by somebody. So the software people develop softwares which are very much essential for making your programs or giving the inputs or making the functions. So there are computer engineers. Now, how do the computer engineers get information about what is required for your hospital or what programming is required? A software is required for you in the health management information system that we use. It is the healthcare providers, it is the nurses who will give them input about what sort of a software is required for planning duties or what sort of software is required to make a nursing care plan using digital technology. And then the person who buys the computer, the hospital, they also act as a link between all these type of stakeholders so that the patient care becomes the priority and they are able to give better output. Product manager. So here what they do is they do decision support, staffing, scheduling, bedside, handheld terminals, etc. So decision support devices, this particular manager will procure staffing related functions. Whatever is a function that is essential will be procured by the person as per the description of the persons who are handling this particular devices. Next is clinical system installer. Works with the vendor who is selling the computers. Helps to train the users, license, or they act as a coordinator between various stakeholders again. System analyst or programmer works in the information systems department. Like it's an additional role of liaison where they are actually involved in getting the information systems done. So these are all the roles. There are many more roles that have emerged after Hersher described the roles in the year 2000. So how do we use computers? So I can share my experience. See, in the year 2006 7, when I went to US, I had hardly got any knowledge on computers or how it can be applied in patient care practice. It was difficult for me initially because see, the orientation program will take care to see that you become competent with the technology, to identify how it has to be used, how it has to be saved, how to log in, or which functions to be used. All this is there. So generally what we do even now, even in the NABH accredited hospitals, we have the health management information system, but exactly we are not getting into the practice part of informatics, because what we find is it's all documentation alone that we are dealing with. So to have proper nursing informatics in place or computer infiltration into our day-to-day activities, what is very important is that every healthcare provider or every nurse who is assigned to a patient should be having a computer. So in developed countries, especially big hospitals, they have something called computer on wheels, where each nurse is having a computer, and that computer is there for that particular shift for that particular nurse. All the information is fed into the computer. You can only log into the your assigned patients. You have your passwords. There are mnemonics or codes that are used, and then when you access through that, you will get your list of patients who are assigned to you. And starting from initial the admission assessment to even discharge of the patient or transfer, everything is handled through that particular computer. Say ordering investigations or removing medicines from your department's pharmacy, because you are not going to the pharmacy physically. There is a common pharmacy there. You use your computer and you have to unlock the particular um, uh, the medicine trolley or your pharmacy, and with that you can take out the medicine. So everything is being counted. Medicines that you give are scanned, and it becomes so handy because especially for the struggle that we and our nurses take in preparing nursing care plans, it really works well when we have personalized computers for patient care which is available, and every evidence based information is available there because everybody is using the computers. So provide work list, remind planned interventions. Suppose your patient requires nebulization, or your patient requires say some wound care, or your patient requires pain medications, so it is giving you a reminder every second hourly or every fourth hourly, whatever is there. The computer is able to, the system is able to give you reminders. So planned interventions are held according to the plan. Electronic medical records and computer based patient records, they become very much part of this. And monitoring devices, vital informations or vital signs directly fed into the patient record. You don't have to go and check on everything because it's connected. Monitoring device is connected to the patients, especially those who require these type of devices. They're connected with it, and there is a monitoring system available. You don't have to keep on observing all the time. If there is a variation that you notice, it is also getting notified to the nurse who is assigned that particular patient. Computer generated nursing care plans go a long way. See, we write, our students write nursing care plans. How many nursing care plans we write? And what we do, we take the points, we note down, and we prepare. And it's not the care that you provide that you are documenting, and you are not evaluating it properly. And the best reason why we must use computers is because nursing care plan and nursing diagnosis, it works really well when we have the computer, because your initial assessment, your admission assessment, and daily shift assessment is directly linked to the list of nursing diagnosis that appears in the computer. For example, my patient has eye discharge, my patient has pitting edema, or my patient has breathlessness today when I admitted him. And next shift nurse assesses. You find that oxygen and other interventions are given, the breathlessness is not there. Next shift nurse will not get breathlessness as a nursing diagnosis. So, depending on that day's assessment, your list of nursing diagnoses appear on your screen, and your job is only to say which is the immediate priority, which is the intermediate priority, or the which is the least priority. It becomes very easy. Now we work in a system, and our students are trained in a system where we simply maybe by heart some nursing care plans. If you ask the students, they always have 5 or 6 nursing diagnoses. They write it for their patients, they also write it for the examinations, theory or practical. It is not meaningful, whereas when it is the actual, maybe our assessment should be the focus and documentation should be the focus. Everything else is already set. Now, suppose the breathlessness is a problem that the patient has. It's very easy. You don't have to identify what should be done for a patient who is breathless. You may be the dumb nurse, you may not be the experienced nurse. But when you identify breathlessness is your priority problem, side by you will get all evidence based interventions which are to be done for the patient who is breathlessness, who is having breathlessness. And at the end of it, once you provide service, you are documenting, and again through computers. At the end, it is easy for you to evaluate. Okay, I have done first intervention, I have done the second intervention or fourth intervention, remaining interventions are remaining there. So once what is planned for the patient is done, only you can close that particular, you can give a closure to that particular service that you're providing during your working hours. So that's how the nursing care plan works. Again, the pathways also will say in what direction the care is happening from the time you are admitted to how is the care process going on and what is recovery that is there. Automatic billing that we know here also we are doing, but remember in many countries where nursing informatics is well developed, you always have a storeroom where you have to punch, and with your card only you can enter even if you are a nurse. And when you go with your computer on wheels. Okay, I want to take IV set for patient A. I have to take that. What is the size? Everything has to be decided. I scan. Automatically, it is built. Similarly, every supply, everything is built based on your use of information technology. It also gives you reminders so that it is easy for you and ensures comprehensive charting. I hope this information is clear to you. But when you practice, see, these practices are yet to come. Most of these are yet to come because we are totally not information. We have not replaced with the information technology. We do have management information systems and health management information systems, especially in NABH accredited hospitals and modern hospitals. But even then, we have not incorporated these functions into our clinical practice information technology. So, electronic health records play a very important role in providing quality, safety, efficiency, as you understand from the description that we have given. And clinical data are legible, organized, complete, and it can be used by multiple players, multiple care providers. Not only in the patient's room, but sitting in the OPD, you can still do if the patient is under your care. So, multiple places, multiple people, multiple episodes of care. For follow up, also, it is going to be so beautiful because many times we go to the OPDs or we go to the clinicians, there is no continuity of care because we don't have the habit of preserving the prescription that is given, or we don't have a book like thing where continuity is observable unless it is a very serious illness that people are particular about maintaining that particular document. Data is entered in real time. See, when you give the injection, at that time you scan the barcode, you scan the patient's armband and give the IV antibiotics. So at that time, real time of care is documented. Whereas what we do here, we give injection. After that, maybe there are hospitals where you give all injections for everybody. At the end, you go on documenting based on your prescription slip or your list what you have prepared. So you are not able to identify if in medicine is given at right time and if it is given to the right patient. All these things are taken care when we have nursing informatics in place. Automated physiological patient monitoring, which I already mentioned, it eliminates duplicate manual documentation. See, if you are using soft copy, everything has to be soft copy. You can't be writing something in the paper, something in the using computer. That should not happen because again there are chances of missing such documents and information. It saves a lot of time and relieves the nurse for other care what she or he can provide. In nursing research, also, this nursing informatics is very much in use. People who are already doing projects and research understand that it helps a lot in literature search. Good old days when people used to go to library, dig for journals, dig for dusty books. The days have gone and research has become much easier because of the information technology or informatics. Retrieving evidences have become so easy, and nursing research also will lead to evidence-based practice. Evidence-based practice is not possible if we don't have good retrieval of authentic information, and proper search may not happen. We may miss evidences. Whereas if we have computer technology, it becomes far more easier to retrieve evidence and announce what are the evidences that can be practiced. Adoption of standardized language and terms also becomes mandatory when computers are used, because you are not using your language ability to write. See, there may be boxes where you have to only click, everybody gets the same information, and key terms also becomes easier. If you're talking from the context of nursing research, we know in research and publication there are keywords which are used, and standardized terms or language, it becomes a habit for us to use it, so that when you use a search engine, you are able to retrieve the evidence. It also identifies trends. Okay, what are the infections, or It also tells you, okay, what is the recovery rate among COVID-19 patients? Or you are able to say which antibiotics is working better. You are able to say how the growth is happening in children. So it is possible by by entering the data, and with that you are able to identify the trends or changes that are happening. When you are able to identify the trends, you can also do predictions. You can also take precautions or corrective actions you can take when you identify the trends through research. Use of knowledge base via internet is very much mandatory, and it is playing a big role in promoting research. Not to leave the nursing administration behind, because it's about managing resources. So we can use lot of functions of informatics can be used in nursing administration. Automatic staff scheduling, we know how difficult it is to schedule duties. Emails, and people say, okay, whom you like, you put in this duty, or in which ward you have posted. So that will go when we have automated staff scheduling. Emails have improved communication efficiency and clarity of communication, and easily it can be sent to all. Cost analysis. We can find out what is the patient care cost. See, many times we would have cared for patients. We have used so many supplies, so many equipments, medicines, but we are not able to bill that to the client who's used that particular service. Sometimes you also find, even now in the hospitals, okay, you buy for patient A who is able to bear the expenses. You have patient B who is not having so much money. But is it right for us to order for client A and shift all that to patient B? So then the costing will vary, and it may result in problems. So cost analysis is also one area where there can be lot of application of informatics. Quality assurance and outcome analysis. When we say quality assurance, generally what we do in our healthcare setting or in the academic practice is that we do something you would have heard about: audit. So audit has two types. One is prospective audit, the other one is retrospective audit. And many of our mechanisms of quality assurance may be using the retrospective audit. You find out in the as a part of accreditation, we do retrospective audit. Okay, how long the patient stayed, you look back the patient charts from the MRD and say how many have written discharge summary, whether there was any error in medication, whether there was a delay. All this you find out, but the patient is gone out of your hands. You cannot do any improvement, or it will not benefit the patient. At later time, when your administrator or your department plans, maybe you make some policy procedures so that you see that there is no delay in medication. Whereas the beautiful part of nursing informatics or use of computer technology is that you can actually do concurrent quality assurance using information technology. I can tell you some personal examples. Like I had a brief stint working as a registered nurse in the US, and it was initial period of my orientation was complete, and then I was working in a telemetry unit. And people, and they usually follow this joint commission accreditation for healthcare organizations in all those big hospitals. And what they do is that they used to do prospective audit. So how you come to know? For example, you are if you have 6 or 7 patients, you need to do a fall risk assessment. I'm just giving you a simple example. Fall risk assessment, and there is a standardized checklist available saying, okay, your patient is having variation in the blood pressure, your patient is hypokalemic, your patient has blindness, your patient is having unstable gait or musculoskeletal problem. I'm just giving you some examples. So based on this checklist, every shift as a nurse, you are supposed to be assessing the risk of fall. I remember I missed some time. One time I missed making this fall risk assessment. So what happens if it is retrospective audit? You will come to know only at the end once discharge is over, because nobody else is going to look at. But there are concurrent auditors, and your computer terminals are connected to a main server or main place. There are people who do this quality assurance work. And I remember, see, it was, see, duty starts I used to do night shift. So night, around 6:45 we start the work. So by 9 or 10 o'clock, if your initial assessment is over, that means you are done. But in that initial assessment, you need to do a fall risk assessment. I have missed it once. So you find around 10 o'clock or so, you get a slip, hello slip, saying that, nicely they word it, saying that, okay, you are so and so patient, dash, you have, you failed to do this fall risk assessment. Same thing may come for somebody. It's like a card, it comes slowly, they come and give you, so you know it is, there is a documentation. You will be more careful and aware. Okay, you need to do this, it is very important. What, imagine the situation if you missed giving an antibiotic or there was a delay. Even if there is a delay, they will send you this slip. Suppose after I got that yellow slip, I remember thereafter I was very careful about doing this. So suppose you find that you are doing it every day after getting this particular slip, and then they also send you an appreciation saying that, okay, from this day to this day you have been punctually or correctly doing this. So it's a motivation. Suppose if there are no errors for an employee after, say, during this particular shift or during this period of 15 days or 1 month or so, they also give you coupons, maybe ice cream coupons, or they give you food coupons, etc. They also put up appreciation saying that, okay, no fault, no mistakes have happened in documentation or things like that. So quality, I'm just saying that quality assurance, the concurrent way is possible when we use information technology. And you can also analyze the outcomes of the services that are provided or actions that you have taken. And when it comes to nursing education, I think, as students and a lot of teachers also may be there. So we have immense scope for using information technology. Thanks to COVID, now we have become very much part of this technology driven education. So we have a lot of computerized record keeping, which the universities may be mandating. Even when we have in this particular phase, we do a lot of record keeping, and all the processes become computer driven. I mean, using computers, we may be using all the processes, maybe related to the staff, related to the students, their internal assessment, examinations, parent related information. We have alumni related information. Plenty of functions are there where we are using the record keeping using computers. Computer assisted instruction, you are all familiar how it can be done, and it is being done more and more interesting way in this particular phase. Interactive video technology. Now, maybe many of our parent hospitals, like in Yanapoya, we have this telehealth facilities where telephonic consultation is provided. There are callers, the numbers are displayed. Patients will call from their homes or wherever they want when they are difficulty. They ask advisors. They also do teleconsultation, and they may be sending records electronically where the team will observe and give you prescriptions. So a lot of technology is developed because it became inevitable because patients were not able to come to the hospital. So the situations will make us use or exploit technology more and more, and telenursing is one area. There is a lot of scope in these type of times and in the future. Distance learning, web based courses, we know how people enroll for such courses, and that is very much part of learning. And we shouldn't be feeling that distance learning where you get a web based degree is something that is low, because a learner can really learn if they are concentrating and they are able to follow the assessments and grading. Teaching and presentations are possible, which all of us are doing. So there are so many functions that we are already doing in education. Few list is already given online, tutorials. There are problem based education that can be done. So a lot of functions are possible in education. And when it comes to electronic health records, also I think our system should be so oriented that the young students who pass out of our colleges should also be aware of how the health records, electronic health records work, and what is its function, what is the role that we can play, what are the ethical issues, what are the privacy issues, and how legal issues can come up, and how to use a mobile phone, to what extent you can share data, to with whom you can share data, and about documenting rightly can be trained during the learning phase of all the students. And when it comes to learning the skills, clinical experiences, we know that there is immense potential for human patient simulation, simulation scenarios, simulation labs are actually very tech savvy places where you have all the functions that are fed into the computer. You can alter and change or create and give such real life situations, near real life situation to the learner, so that they are able to handle the situations very easily. So simulation is one area, there is great potential, and as examinations and placements are also based on simulations these days, especially that which happens in the Europe and other countries. I think our students should be exposed to such situations greatly. The advantages are plenty, that the information technology and informatics will make us lifelong learners, because these skills what you learn are going to be imbibed and become part of your life. Adapt to e-learning for skill development, because you cannot go to college leaving all your responsibilities. You have to depend on e-learning portals to update your knowledge and skills. And there are so many plenty courses available, like Swayam and Coursera. There are so many courses which are available for students and the registered nurses alike, which can be benefited if we are tech savvy and use this technology. Reliable evidence-based care is a great potential, where the reliable evidences are actually summarized and made available to clinical practice, so that clinical nurses do evidence-based practice. Otherwise, they may not be reading a journal or they may not be practicing that. So we should make more and more use of evidence-based technologies. Next is social media. Now, we have to reflect how we use the social media and how professional the communication has to be, and in what direction it should flow. Faculty need education in this area, smartphone use possibilities. Now, as we understand, lot of the students are using logging into classes through their smartphones. So they have learned what are the possibilities, what can be done to use smartphones for educational purposes. Otherwise, they would have only used it for entertainment purposes. Now they are also exploring how to use it. So there is immense potential for exploring on these areas and exploiting these resources. In interdisciplinary programs, also informatics can be widely used. So having done that discussion, now let us see how can we integrate informatics into nursing education. First of all, let us reflect, is it sufficient? Till the other day, we were telling the students no mobile phones. We would appreciate students who didn't have mobile phones. But can we survive in this generation without mobile phones or without internet or without computer technology? It's very much important. So I think we need to emphasize where it is required and tell them restrict where it is not required. But it has a great potential for learning. When to use, when to integrate. Is it to be integrated only for final years, or from the young age it has to be part of your learning? How it has to be learned? It is not necessary that mobile phones have to be used. You can give an exposure to simulation. You can give an exposure to electronic records. You can give them an exposure to how auditing can be done, where it can be done. It can be done in the classrooms, in the clinicals, when they do their research. For example, I can tell you our students are using Google Forms now to collect data. They submit assignments through the computers. They also make a lot of programs, like we couldn't do farewell programs, or we couldn't do the presentations of reports of their projects. They are doing online. So it is possible. Technology is here. We have to make the best use of this technology, the information technology, and be better learners and be better prepared to face the future. So, of course, there are issues. We are not without issues. There may be misuse, there is a lack of authenticity of information, there are issues with connectivity, issues with the acceptability, and issues with the type of learners and the technology used, etc. But all the issues become small when we think about the benefit of information technology that will aid in nursing education. So there are some people who have said what are the key issues in informatics. Mainly what they have pointed out is connectivity issues that all of us may have faced sometime. And electronic health records, I have already told you. When we say electronic health records, we have to think about the privacy issues, confidentiality issues, legal issues that we face, permanency of records. What if the records are lost? And what if it is shared to people who are not connected with it? Confidentiality, privacy, all this is going to be affected. So, how we take care? We have to follow ethics. We should have policies, rules, regulations, guidelines when electronic records are in place. Because if you give your password to everybody, everybody will see the record. So, that the people who handle it, they should have this ethical practices. Cost benefit analysis is another area. Now, when we talk about what is the cost of doing information technology or making your hospital or college info tech friendly, so cost and benefit is one area. The other area is consumerism and wellness. So when we talk about cost, we know that there is some investment that is necessary for hardware, software. We need to train people, we need to implement, we have to maintain all this costs. But it could be one time investment. It may not be the investment that is happening continuously. So it is worth investing in technology. And initially, as you install all these, there is a temporary decrease in the provider productivity. You may not be able to take class online as much as the classes you handle in the offline classes or physical classes. You complain, you are stressed, you are finding it difficult. But now most teachers who are doing the online classes feel so comfortable. They say that okay, even if you are working from home, it is fine because you know what is the technology there, you are able to handle the problems, and it becomes easier. And we might have few people who may be asking, is there a possibility of working from home in the future? Now the students may come back and ask us, so give us a holiday 1 month in time when there is hot weather, we will be at home and we will still attend the classes. So this is going to come because the cost, acceptability, all these things will come into the picture. Savings, and lot of savings because you are able to decrease the errors, you are able to capture every information, cost you are able to estimate, you are also able to improve the efficiency of people who are rendering the services, you are saving time, you are also having less demand for space because you are able to manage all your information using information technology. So the cost outweigh the, or cost benefit outweighs the cost. Therefore, it becomes more and more acceptable. But we have to be ready to do that initial investment, the cost, because it is going to give you lot of services. And also the key issues of consumerism we need to consider patient centered or wellness oriented services. So are we ready for patient centered or wellness oriented service? Because all the services that we provide or the information technology or informatics what we use need not be for patient who is admitted in the hospital. They may be in the satellite centers, they may be in the outreach centers. Still, are we ready to provide that service? Are we able to have continuity of service or continuous monitoring? Or are we able to give consultation? So this is being patient centered and wellness oriented. There is also need for information savvy people who will help manage internet information. And I'm sure all of us who may not have been so comfortable with informatics have become better today because we are using it and it has become inevitable. Similarly, telemedicine and digital personal health records, web based records, or smart cards which people carry with all their data. So, they are all going to be handy. And if you have to handle this type of consumers, the nurses also need to be info savvy. They have to be comfortable with information technology or informatics. What about the preventive services? In primary healthcare, a lot of people make use of informatics. People may be using it for simple surveys. There are colleges which use different survey softwares. It's very easy to analyze the data rather than sitting and making your master charts and breaking your head with frequency and percentages. It becomes very easy because automatically the data is in place. And what about family folders? For example, in the usual community health nursing, what I can say is people practice family folders. What if we have an electronic health record? It becomes so easy for us to update the family details and provide the services. So there is immense scope for being tech savvy and provide and improve our services. Other concerns are safety and security of information, ethical issues, as I mentioned earlier. Errors could be there, and the error is because of the human component that is involved. It may not be the machines. So your error can happen in entering, retrieving the data, or communication of the information obtained
Yeah.
from the computers. There could also be technical errors which can come in. So the organizers were asking me also to list some of the careers in informatics. What are the careers that we can look for? See, it is new specialty and it has clinical, administrative, research, and educational purposes. So, if you want to be an informatics person, you can focus in clinical area or administrative, or you can only do in research and become evidence-based nurse informatics. Your work will be only to produce evidences. You can also do a lot of innovations in the education area as we discussed earlier, but they interrelate to deliver evidence-based practice. So if all these four spheres interrelate, then we get a evidence-based practice which will benefit everybody. So what is important is that there are many careers available. I feel many of these designations are maybe specific to particular hospital, like you use the word tutor, you use the word clinical instructor, or assistant lecturer. Maybe things don't vary much. In each place people use it interchangeably. So these are some of the careers. Chief information officer. So the person will be the chief. Maybe there are many people working under this person. Nursing informatics consultant. So this person, I may be a consultant. I can guide hospitals which are going for NABH accreditation, how to make care plans practical. So, this is my knowledge or my experience, which I am ready to share with somebody else at a cost. That is, nursing informatics consultant. Network administrator. Maybe sorting out internet issues, internet, intranet. There are so many net facilities available. So maybe this person will be doing the overall in charge, overseeing the things. Data repository specialist. So now the data is put in one place. You need to see that the data is stored. You need to retrieve the data when the data is required or asked for. So this person is a specialist. Nursing informatics project manager. So there may be a project to make informatics in a particular area, or working on a project to improve efficiency through informatics. So this person may be working on the project. Nursing informatics educator. Like if you are thorough with the information and we have the skills, we can go and educate people how to do it. You may educate the students, you may educate the nurses who are working where the new facilities introduced. There is immense scope for that. And clinical information liaison or coordinator. So, what this person may do. Now, in many times, Western countries, we have shorter hospitalization because insurance companies don't pay for hospitalization unnecessary. So, you may be a person who is having a particular chronic on some serious illness. Within 2 3 days, you become stabilized. Your hemodynamic is stable. You are shifted to maybe institutionalized care, or you are shifted to home care. So there is a community health nursing agency which is providing the service. So this clinical information of the client will go to that particular community care agency or visiting nurse through this liaison or coordinator. So there may be patient care coordinators or case management team which may be doing this particular work. Clinical information manager. So what they do, they manage the clinical information. Clinical analyst. Now, especially when accreditation is there, this role of analyst may be more. Now, in NABH accredited hospital, we have quality indicators. You have to say what is the SSI, surgical site infections, or you have to say COT, or you have to say what is the WAP. So there are so many indicators, and we need data about all these things, which may be used by this clinical analyst to analyze and say, okay, whether this is acceptable WAP, or whether ventilator associated pneumonia or surgical site infections. So you can also do benchmarking, comparing, seeing that the quality is better because this particular incidence is less. So all this can be planned by the clinical analyst. Nursing informatics specialist, I think it is overlapping somewhere. Clinical information specialist. So all these people are actually dealing with the data that is available using the computer, and they are trying to manage the patient care or clinical situations so that we get correct information at the end. So this nursing informatics has a great impact on nursing profession, which I already discussed with you. It can prevent medication errors, easy to interpret orders. It's easier to collaborate for patient information. Better assessment is possible. Utilizing research finding is possible. Makes person work smart. So it's going to have a greater impact on the profession. On the healthcare profession, we know that papers are becoming less, information can be accessed from anywhere, it becomes easy to collaborate with others. It also reduces turnaround time. What is this turnaround time? From the time you came to the hospital for consultation in the OPD to the time you went out, or from the time you placed an order for IV antibiotic to the time the antibiotic has come to your unit or delivered to the patient. So this is the time, total time that is taken for completing a particular task. So all this can be monitored from ordering time to the time of getting. So it has greater impact on cost of care. Initial investment is there, but later on it reduces the cost of healthcare. So, nursing leaders have a great role to play. They have to be firstly tech savvy. They should also be ready for collaborations with other players or partners for making information technology. We should be ready for feedback. Discussion should happen. Partnership should happen. We should also have innovations, because with innovation, you are able to design a new product, or you are able to make a new software that is more user friendly. We should also be ready to take the risk, also obtain feedback, make revisions. All this is a role of the nurse leader. Firstly, what we need to remember is it is a leader who makes the change. Change management is important. The important part of change management is that nobody likes change. I don't like change. I like to be comfortable the way I am, because I have been practicing it this way for 10 years or 15 years. So initially, when you introduce the nursing informatics or computer technology, the first thing people do is they become jittery, they will react. They will say they are finding difficult, they cannot manage, they are going to quit, they say they are stressful, they are anxious. It is also with the initial phase of online classes, isn't it? Everybody was complaining. But once you become familiar, people become accepting. So the role of the leader is to appreciate the accomplishment. If they have a problem in understanding the technology, do the help and solve their problems, make them comfortable. Also take their inputs. So that is the role of the change management that should be done, because you are going from traditional practice to the nursing information technology. Support innovations, effective communication should be there, and clear communication. Role of policy procedure guideline is important in reducing the institutional risk, because the confidentiality related problems, legal issues should not be faced by the institution. Therefore, you need to have the guidelines in place. So technology should help us work better. Many times we hear, isn't it? The places where which are going for NABH accreditation. You talk to any person there, they will be overwhelmed with the burden of documentation. They do documentation, redocumentation, they do changes, and everybody becomes confused and they become overburdened. The purpose of technology is to reduce the burden. So once we are at ease with this problem or new introduction, then things change and everybody will get comfortable. Advocacy role is very important, because you have to, there may be people who are against having information technology. They may say, okay, why the nursing department needs this? What are you going to do? What change it is going to do? What result is expected? So what you have to do is advocacy roles to move in the right direction with your thoughts, beliefs, actions. You have to influence concerned people so that you get proper cooperation and support for making your department information savvy or info tech. So there are few references for further reading that you can do, and a big thank you for all of you for being part of this webinar. Um, and I'm really sorry for the delay. I hope I have finished in time. Um, um, if there are any questions, I am ready to handle those questions. Or if the questions are there in chat box or anywhere, the organizers can ask me. Thank you so
Yes,
much.
Dr. Leena. Yes, Dr. Leena, it was a very comprehensive session. Actually, you started with the terminology and concepts and beautifully conceptualized comprehensively for everyone to understand what was the topic of the day. So there are a few questions. I'll hand over the mic to Professor Grisha Chus. She will divert the question to you. Over to you, Professor Grisha.
Good afternoon, ma'am. There are some questions which were taken from the chat box. The first question is,
Can you hear me?
yes, ma'am, yes, ma'am. Can you hear me? Hello, can you hear me, ma'am?
I cannot hear
Yes,
you.
yes.
Hello,
एक मिनट
hello, can you hear me, ma'am? Hello,
Grisha, can you hear me?
Yes, yes. Yes, we can hear each other. Yes, continue.
Hello. I am
Lena,
able
ma'am.
to hear you. You could hear me clearly,
Yes, yes, it was very clear.
but I cannot hear you. Any questions are there?
Yeah, questions are there. It was they were the question. You are checking on the WhatsApp questions. So you can directly answer.
Okay, okay, okay. ಅವರು ಕಂಟ್ರೋಲರ್ಗೆ ಕಾಲ್ ಮಾಡ್ಲಿಕ್ಕೆ ಹೇಳಿ.
Okay.
I'm so sorry for your
Yes, ma'am.
questions, but Madam Bridget has sent me some questions.
Yeah,
Uh,
we have
I
summarized
will try to
questions. Yeah.
answer that. If you are not
Yes, ma'am.
satisfied, you can again get back. First question is whether technology will fulfill practical knowledge gap of the students. See, technology, in my opinion, will definitely help fill the knowledge gap of the students, practical knowledge gap also. See, what we were doing is we were so comfortable with the traditional method where the student has to go to the clinics to learn practicals. But this COVID pandemic has taught us, and also we were able to explore what are the practical resources that are available, what are practical based courses that are available. Even see, you think about anatomy or you think about microbiology, you think about videos of procedures. There are so many portals which are available which can actually take care of even very small skills that are essential for practice. And definitely technology like simulation technology will go a great extent in actually giving a correct understanding of the clinical practice. Think about conducting delivery. I remember my days as a student. Many of my batchmates didn't even go to the labor room because they were scared, and we were uncomfortable with the type of order that was there in that place, and it was very scary situation. But now the young students using technology through simulation, they are able to learn, they know what is going on, and later they go and see a real practice. It is going to be more a learning experience than a student being put into anxiety. So therefore I feel a whole lot of things can be learned using technology. However, we cannot totally stay away from practice. First you experience with technology, and definitely you need a real time and real experience in the clinical area. It's not a substitute for the real time clinical experience. Therefore both should be appropriately used. Maybe we should say, even Indian Nursing Council was proposing, okay, 30% simulation and 70% clinicals. So acceptable formulas have to be used, and it has to be evaluated after going through this particular model and see if
Ma'am,
those desired clinical
ma'am, one more
competencies are
question is there.
achieved by the students. That is very important. If you are not clear, then you can ask the clarification again. Second question is, patient has a lot of information about disease. As a student nurse, how to handle them in providing care? It's very much true that our patients are so much information savvy or tech savvy, and we have this Google, which is a superhero giving all sort of information. We have lot of blogs, people responding their experiences, and sometimes we can say it is misinformation also that the people carry. And when they read such information, they become panicky or they ignore certain conditions without even consulting the healthcare practitioners. So, what happens when we are getting clients who are so much super tech savvy? You should not be lagging behind. What is very important is that as healthcare students or nursing students, we should be competent to handle them or ask their queries, clarify their doubts. And sometimes I feel it is sad to note that students or learners may not be very careful to know what is the condition of the patient whom I am caring for this week. This first patient is assigned to me, okay, peptic ulcer. Now you have to expect what is the question. Okay, what is peptic ulcer? What diet is advised? What should not be consumed? And what is the prognosis? You have to clarify. And if as students who are caring for them or part of their caring, if we are not able to answer their queries, they consider every nurse as a dumb nurse, and that is how the profession loses respect and dignity. So therefore every interaction, even if you are a student learner, caretaker, should be made best use, so that your client will have an everlasting impression saying that although she is or he is a student nurse, look at the confidence, look at the correctness of information. So that's how we can all influence the clients, and therefore lift up the image of the profession. If you don't know, you should not also be saying wrong information. You can say that, okay, I will study the details and get back to you. But anything you are asked, you cannot say that. Then the person will think, okay, this person doesn't know anything, he has to refer. That's also not right. So what you don't know, you should be ready to say, okay, I don't know. Never give wrong information to the clients. That is wrong. What is the role of teachers in guiding students on infodemic? So, students, teachers, firstly, teachers should be aware about what is the infodemic, information epidemic in the negative sense. So, we should be also handling it well, not overwhelmed, and should not be tempted to forward every message that is got. We have better abilities to verify what is the correct information. The corrected information or authentic information can be shared, so that people who have misconceptions will avoid or reduce this misconception, and every opportunity that we have with our students can be made use. And This, it is very important that we emphasize and re-emphasize, because you say once, people are not going to stop sharing. You find people sharing not so relevant information to every possible group they have. So this tendency has to break, and then the student should be told how they can keep themselves busy, how it is damaging, how it can be taken care. How do you think hospital protocols limit health infodemic chaos? How do you think hospital protocols limit health infodemic? So, for example, if you're talking about hospital protocol, um, what way it will limit infodemics? Actually, one hospital alone may not play a role. So here the role of the professionals, the licensing bodies, the scientific community, the journals which give authentic information play a role. And the journals, the protocols of the hospitals has to be evidence based, and this can be displayed through our systems of display in the hospital. You can use mass media like televisions, or you can use radios, community radios, etc., to spread the information. I don't know if I have answered that particular question. So, hospital protocols play a role in limiting the information to the healthcare providers. But general public also need to be sensitized about this. Recently, it was proposed to do COVID-19 tests for people of DK. Is it mandatory to do the test for mass population? So, the reason why I do not know if it is very, I'm that person to say, but what I can say is that they want to identify what is a trend. They want to identify if there is community spread, or they want to identify whether everybody got, whether antibodies are seen, and the risk can be predicted. So it is helping us in identifying what is a risk, what is a trend, whether it has gone to the villages, and now who are the people immune. Now they can also find out. See, now we know that there are studies and literature available which says that diabetics are at higher risk of mortality, or hypertensives, renal diseases. We do not know if there is any other category which is at risk. So all this we will come to know when we have data on what is the prevalence, or what is the incidence over a period of time. You can also find out how fast the disease is spreading. So therefore, they may have a reason why this community survey is carried out in the Dakshina Kannada district. What is public responsibility to avoid false information and social media responses? So public responsibility only is to resist forwarding information unnecessarily. And here, it is sad to note that even our mass media, like television, played a very great role in spreading misinformation, fear, and panic among the public, because it is reaching millions of population, and people not knowing, they spread the information, leaders spread the information. They are all people who are having ability to influence. The actors and actresses spread lot of information. So the people who have power to influence should be extremely careful in stopping this insane spread from happening. So each of us are able to influence. So we also have a greater role to play in controlling our public. You control it at home, you control yourself. So a lot of people will get controlled. Some nurses are not familiar with computer systems. They do not know how to use. Some are telling writing is better. While typing, they consume time. It is very much true. So when we started using computer, see, when I started I went for a very short-term course to know about the computer. That was way back 98. I went for that. So you know about the computer basics, a basic programming. You know how to use a word. You know how to use the. When you become a teacher, you should know how to use PowerPoint. You are doing research. You should know Excel. You should also know how to use SPSS. It is the need. We have to grow according to the need, or we have to adapt according to the need, because change is very important. Change management should be efficient. According to the time, we have to change. And if we are not computer literate, it is as good as we are illiterate. Therefore, it is age has no barrier, exposure has no barrier, opportunities can be provided and made use, so that people become computer literate. And with basic literacy, you can do lot of functions, and thereafter you grow doing this particular task at your workplaces. See, it is easier if you look at the small children, how quickly they adapt to technology. So similarly, even elderly population, old population, middle age can also develop. We may not be that fast or smart, but we should be able to manage. That is because we know that it has become inevitable. And maybe computer literacy from smaller age, what is proposed and provided, will take a long way in we getting people who are more computer literate. And maybe our public libraries, like in the west, what they do is, even people who are very least educated know the computer. The reason is that their community libraries are a resource. They have computers kept there. People can come and use it for 1 hour free. And again, if there is nothing, nobody else waiting, they can still use. So everybody uses computer. They use email. They use different systems using the computer programs. So we can learn. See, now if we can use WhatsApp, we can use the functions of the mobile phone. Definitely, every technology can be learned. And smartphones have made our job easy, because most functions that are there in a usual computer is also possible in most mobile phones. So we have to wait for some time. Everybody will become tech savvy and change. It's quite natural that people oppose when you think about modernizing, because we don't want to come out of our comfort zone. We don't want to take pains. But with little motivation, experiences, teaching, people will change their attitude. So with that, they become tech savvy and they will start using. So, any other questions? I hope I have answered all the questions that have come to me. If you have anything else, you can ask. I'm so sorry. I cannot hear what is spoken.
No, ma'am, that is all the questions are. Any participants want to ask any more questions? We can take one or two questions. Any questions from the participants? If not, so we will conclude. Over to Ms. Ashita.
I think we have addressed all the questions. Thank you, ma'am. On behalf of Tejasvini Nursing Institute, it's my privilege to thank our distinguished resource person,
But it is
Professor Leena
we
Casey.
are not comfortable when we are not knowing the technology. It is quite sure that we'll be stressed. We feel that we are less competent, or we feel that we may do more errors. But you will get used to it.
I think we have taken up all the questions. There are no more questions. Madam Leena, can you hear me? Okay, Ms. Ashita, you can continue.
On behalf of Tejasvini Nursing Institute, it's my privilege to thank our distinguished resource person, Professor Dr. Leena Casey, for not only sparing her valuable time, but also readily accepting our invitation to be the speaker of this webinar. Thank you so much, ma'am, for
Once again,
enlightening us.
if there are no questions, I have not got any further questions. So once again, a big thank you for the organizers for giving me an opportunity to share this experience of mine. I hope it was beneficial. Your feedback is very important. Please give your feedback. Once again, I'm extremely sorry for the initial delay that happened due to these technical issues. Thank you so much. Have a good day.
Thank you so much, ma'am, for enlightening us with your analytical, thought-provoking process and for inducing critical thinking in nursing practice. It was indeed a great deliberation. My heart goes out to thank our respected delegates for readily accepting our invitation and joining in this webinar. I would also like to thank our management, our respected principal, Professor Bridget De Silva, Vice Principal Dr. Grisha Jose, and all the teaching staff of Tejasvini Nursing Institute for working as a team in organizing this event. Once again, I thank you all.